Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The Health and Human Services Department has identified 2 new priorities. One is improving data used for artificial intelligence. Another is better use of information technology in the delivery of behavioral health services. The National Coordinator for Health Information Technology's office recently made a series of small awards towards these goals. Joining me with details from the Office of the Assistant Secretary for Technology and Policy, Public Health Analyst Allison Kemp. Ms. Kemp, good to have you with us.
Thank you, Tom.
And tell us about this program. This is coming under something called LEAP. What is LEAP? And then we'll get into the priorities that you have funded here.
Yes, LEAP stands for Leading Edge Acceleration Projects. And so then the whole title is the Leading Edge Acceleration Projects in Health IT. And this program addresses fast emerging challenges that inhibit the development, use, and advancement of interoperable health IT. The projects tackle the creation of new standards, methods, and tools to improve care delivery and advance research capabilities.
Okay, so $2 million. Small money, really, in HHS terms. And these were grants, or were these challenge competitions? What was the funding mechanism here?
These are grants, and they're specifically cooperative agreements. And I know you mentioned that these are small awards, but to these recipients, they're often very large awards.
Sure. And one of them has to do with the idea of improving the data that goes into artificial intelligence use in the healthcare field. What is the issue here, and what are you trying to get out of these grantees?
Yes, so for that area of interest, we awarded to Columbia University, and their project is focusing on harnessing nursing knowledge in a systematic way to better capture the nuances of nursing data, leading to more comprehensive, accurate, and transparent algorithms.
Nursing knowledge. What is the special knowledge that nurses have that needs to be maybe captured in some way?
In their application, they explained how nurses often do so much more documentation than other providers during a care visit. And so the nurses may have a much better idea of the care that a patient is receiving. And so their project is proposing using the data that nurses are collecting in algorithms, which is a new area that's not often the data that is used in algorithms in artificial intelligence.
Sure. So just to make a typical scenario, someone has specialized surgery, and maybe if you're lucky, you'll see that surgeon one more time, 2 more times while you're recovering. The nurses see a person every hour, and they have a sense of the totality of what the person is going through, unlike the surgeon who says, this 2-inch square area is good to go.
Yes, that's correct. And so one of the things that they're looking to consider in this project is whether data in a patient's healthcare record is missing or if the care was missed. And so they'll be interviewing lots of nurses as part of this project to discuss what the traditional flow of care is. So, step 1, step 2, step 3, and then if maybe step 4 isn't recorded, does that mean that it just wasn't recorded, or does that mean that step 4 didn't happen? And so they'll be talking through all of these processes to determine whether or not the care was missed or the care wasn't written down.
And is the idea eventually that nurse-created and captured data would be better for artificial predictive models?
Yes, that's what they're thinking, because like what you said, a clinician might, a doctor might see a patient just 1 or 2 times or for a short amount of time, but the nurse is seeing the patient so many more times.
Interesting. Yeah. So we're speaking with public health analyst Allison Kemp from the Office of the Assistant Secretary for Technology Policy at Health and Human Services. And your other grant is for the idea of furthering health information technology in behavioral health. What's going on here?
With behavioral health, there is a lot of differences between seeing a behavioral health provider and seeing any other type of provider. So they don't participate in health IT incentive programs such as those under CMS. So they can be lagging in health IT that they have available. So this project is really looking to improve that for their patients. And so this award was to the Oregon Health and Science University, and their project is focusing on adapting a tool that has followed some HL7 standards that's called the Multiple Chronic Condition Care Plan tool. And they will be using it at behavioral health clinics that are not attached to physical health sites. And so they will do a lot of evaluation of this tool and then share those results with the sites, the patients, and stakeholders. And they are considering 3 scenarios as part of this tool. So they will be looking at longitudinal care planning for patients with complex physical and behavioral needs, and then monitoring mood disorders with structured patient-reported outcome measurements, and adapting care plans at unplanned transitions of care, so such as like on hospital discharges.
One question is behavioral health and mental health. Are those interchangeable terms?
People often use them interchangeably, but I think behavioral health is often more like whole body care, and the mental health is a little bit more specific.
Sure, above the shoulders, and then everything else is below. Well, I guess it could be above the shoulders in both cases, as well as below in the one case. And so it sounds here like the goal is to bring more orderly processes to evaluating people and creating care for them than has been the case in this branch of health.
This program specifically, is really exciting because they're already using a tool that has been created. So they're going to be piloting it in some new scenarios. So it will really further work that has already been started as part of the standards community.
And you mentioned, I think it was H7 tool?
Yeah, HL7.
HL7.
So it's a standards-based community for health IT. And there's lots of groups working on different types of projects. And part of HL7 has developed this tool that they'll be using in this project.
And for HHS, you will be getting research results from these 2 institutions. How will you promulgate that throughout the industry at some point?
For many of our LEAP projects, we do have blog posts written on ASTP's Buzz blog. And then we also have the tools posted on ASTP's GitHub, which is a repository for all kinds of different technology tools. And so people who are interested in the tools that have been developed as part of the LEAP program can go to ASTP's GitHub to access the tools.
Right. So in other words, you put the research into the public domain, essentially.
Yes, exactly.
And what are the timelines? I mean, how long will it take till, for example, that the HL7 tool could be effective in behavioral health?
We start with 2 years for each of these projects. So it is possible that they could receive up to 5 years of funding, but each project starts with 2 years of funding. And so usually the second year of these awards, the project teams are finishing up the development of the tool and then working on the evaluation. And so by the end of the second year, we should have a tool available to the public.
And on the earlier tool that we talked about, or the earlier project to get the nursing data in some organized manner, it sounds like the kind of thing nurses might have been clamoring for decades. Listen to us.
Yes, it sounds like that they have been working on this project in other forms for many years and really trying to get people to understand how important that the data that they are collecting can be.
Public health analyst Allison Kemp from the Office of the Assistant Secretary for Technology Policy at Health and Human Services. Thanks so much for joining me.
You're welcome, Tom.
And we'll post this interview along with links to more information at federalnewsnetwork.com/Federal Drive. Hear the Federal Drive on demand. Subscribe wherever you get your podcasts.